motion to excuse
That's,
You
absent?
do the roll call first.
Okay.
Yeah, you do the roll call first.
Mayor Condrey, Mr. Richmond,
Here.
Ms. Cash,
Here.
Ms. Sipsey,
Here.
Ms. Lawley,
Here.
Dr. Patrick, Mr. Bonnell,
Here.
Dr. Zollett.
Here.
Do I have a motion to excuse absent members?
Yes.
Second.
Okay. Are there any citizen comments? Seeing none, we'll move on. Approval of the minutes for February 2023. Do I have a motion to approve?
So moved.
Second.
Thank you. Have we received and filed the financial report for February 2023?
Yep.
Okay.
We just need a motion for that as well.
May I receive a motion for that?
So moved.
Thank you. Our presentation today is on colorectal cancer. Is that by you, Dr. Zollett?
Yes.
We do that.
No, I don't know where the camera went. Okay.
Okay, colorectal cancer. 10 minutes or less. Okay, so colorectal cancer. Cancer of the large intestine, which is the last part of our intestinal tract, GI tract, or the rectum, which is the very last part of the large intestine. Typically, it's mutations of epithelial lining, cells lining the colon, and most colorectal cancer, despite what a lot of people think, is not genetically linked. About 80% of colorectal cancer is not linked to any family history. But if you do have 2 or more first-degree relatives with the history of colon cancer, it increases risk 2-3-fold. About 17 to 20% of colorectal cancer is genetically linked to first-degree relatives who've had colon cancer before. The second most common cancer in females, third most common in men. 2020 estimates are that 152,000 people by the time they're all done counting everything up will have contracted colorectal cancer as new diagnoses, and 52,000 people will have died. The risks for colorectal cancer, obviously from what we said, 80% have no family history, no genetic link, so everybody's at risk. But what increases your risk? Obviously increasing age increases your risk of colorectal cancer. For men, it's 1 in 23 are going to develop it, women 1 in 26. So it is a little more prevalent in men. It's more common in developed countries, which we'll talk about here in a little bit. It's more common in African Americans. And the big link anymore is really lifestyle. And that's where the link to developed countries comes in. High fat diets, high red meat diets, high processed foods, particularly processed meat diets, obesity, smoking, and really the lack of physical activity. So kind of the hallmark of an American citizen sitting right there at the bottom of the category there is your biggest risk factor for developing colorectal cancer. And oddly enough, America is only about number 4 in the risk in the world for colorectal cancer. There are 3 European countries who are higher than us. Continuing on risk, because genetics is a risk. So if you do have links, obviously you do have an increased risk. If you have inflammatory bowel disease, which is typically ulcerative colitis or Crohn's, the inflammation that occurs in the colon lining due to autoimmune issues puts the person at significant increased risk for colon cancer. Only about 2% of colon cancers are linked to IBD. One very interesting point is that people over 50 have had a decreasing risk of colon cancer, 1 to 2% since the mid to early 2000s, mostly due to screening. So we're catching polyps, we're catching precancerous lesions, we're removing them early, and the rate of colon cancer is dropping for those over 50. Contrary to that, under 50 has been increasing since the 90s at 1 to 2% per year. I think I have the next slide. Yeah. Can't quite see the last column there, but you get the idea of the risk of cancer, of colon cancer, greatly increases with each 5 years of life. So as you get into your 70s and 80s, you have by far the greatest risk. But those numbers are all creeping down 1 to 2% a year. It's the middle of that graph and to the left, the under 50, that the actual number is still very small, and this is rates per 100,000 population and the age groups on the bottom. But those are climbing 1 to 2% per year. I don't want to jump ahead of myself, I don't want to talk too quick. So in colon cancer under 50, it's been steadily rising year after year, as I said, since the mid-1990s. Mortality is also rising. It's now the leading cancer cause of death in men aged 20 to 49, and no one really has a good idea why this is occurring. The best guess and the main focus is the lifestyle. You know, the obesity rate in the people under 50 is much higher than the obesity rate in the over 70. So the concern is that the lifestyle changes of eating fast food, eating processed foods, not exercising, being overweight has just risen so much. In looking for this presentation, I found a study from Harvard 2 years ago that showed 14 cancers are all increasing under the age of 50. And that decade to decade, the risk of the 8 particular cancers have increased in risk compared to the generation before them. So we're getting better at treating cancer later, but we're getting cancer much earlier. Seems to be the trend since about the 1950s. And those were breast, colon, kidney, liver, esophageal, pancreas, and kidney. And so it's just an interesting phenomenon that, again, kind of has to come back to lifestyle of what we're doing to ourselves, whether it's environmental or how we're eating, lack of exercise. There's definitely been a change, a shifting in where our cancer risk is starting to develop. Anyway, so now the American Cancer Society now recommends screening beginning at age 45 for average risk patients, and for doctors in particular, for patients to really have a more individualized decision-making on when to screen and how early to screen. So the old thing of 50 is kind of gone by the wayside anymore. Symptoms of colon cancer. The big one is any kind of change in your bowel habits. Suddenly get constipated, change in the caliber of your stool. The classic term was always pencil-thin stools. Suddenly had a change in what they looked like. Blood in stool, never want to ignore blood in your stool. You always want to let somebody know, talk to somebody about blood in the stool. As it progresses, if you get more advanced disease, you're going to get loss of appetite, nausea, vomiting, weight loss. But the big takeaway here is 50% of all patients are asymptomatic at the time they're diagnosed. So if you do go in and get your screening colonoscopy and you find out you have colon cancer, you had no idea of it. Just reinforces the importance of doing the screening test. So diagnosis, the biggest thing again is screening. We used to do the fecal occult blood test, which was really not the best test. The FIT test, which is a fecal immunochemical testing, has replaced it. More specific, simple, it's easy. You don't have to do the colonoscopy prep. It's just a stool sample, but it's still not a great test. Cologuard has come along and is kind of in the same category. It's a little more advanced. It's actually looking for DNA. It's quite a bit more expensive. The manufacturer obviously loves it, but it has a much higher false positivity rate. I'll be honest, as a physician, when I get patients who really need to get their colonoscopy and they don't want to, I'll kind of push for the Cologuard, because if they do get a false positive, they're going to get the colonoscopy. So although it does raise cost a little bit, it does wind up, once somebody gets a colonoscopy, typically they realize it's really no big deal and they'll continue to get them in follow-ups. But so I kind of like Cologuard for that reason anyway. So the gold standard is still colonoscopy, actually getting a test that actually cleans you out, and they put a scope in and you can visually see essentially all of the colon, looking for any polyps or precancerous or any kind of tumor lesions. Obviously, you find something, you gotta have biopsy to know what it is it cancer, is it tissue?
Can I ask a question?
Sure.
I heard that there's an age where you term out now on colonoscopies, is that true?
There was a short period of time when the recommendations were to stop at 75 because the risk of perforating the colon during a colonoscopy, for a screening colonoscopy. So not a high-risk individual, no family history, so just an average risk screening colonoscopy to not perform it over the age of 75 because the risk of puncturing increased significantly. The risk of getting a cancer that is going to kill you instead of something else killing you before decreases. But again, the American Cancer Society, and I think most people are now going by, with the longevity of everyone and health improving as we're maturing, you know, it really needs to be individualized on when you stop.
Okay.
So I've got patients who, you know, are 78 and are healthier than my 62-year-old, and I'm probably still gonna have them get a screening colonoscopy at that point.
It's not a
So
very fast growing tumor though, is it?
typically in the older
The
patients.
older patients,
No.
I mean,
And that's
they'll die
why
before it'll.
if they've got dementia or they've got 2-3 other
Or-
medical history, they have poor heart failure, you know, no, you're probably not gonna screen them. But if they're still walking and
Yeah.
active and pretty well, in great physical health, I'll go beyond 75, but, I'm not gonna be screening an 85-year-old person. Treatment. So treatment, really the biggie is preventive. Don't treat it after you get it, prevent it from happening. So lifestyle modification, high fiber diet, less red meat, weight loss, exercise. Really the biggie to take home is keeping weight in check and high fiber diet. Doing your screening tests. Do one of the 3 regularly. Don't let them slide. Don't procrastinate. If they do find something, obviously getting rid of the polyps or the precancerous tumors. I think the next slide will go into a little bit about survival, but if you've got local disease, the cure rate is tremendously high. So getting surgery, getting partial colectomy, removing part of the colon with the tumor involved, is almost entirely curative for a significant portion of individuals. But then if you get more distant disease, there's obviously chemotherapy and radiation. So survival, if it's local disease contained to the colon, you've got a 90-95% survival rate if you get resected quickly and efficiently and get the whole tumor. If it's regional disease, you still have a 70-75% survival rate, which is pretty high numbers, given you're getting local spread. Distant disease, if you've waited too long, it drops to 10 and 20%. So clearly those numbers reflect how important it is to try to catch this early and get it taken care of, and that all comes back to screening. And that is my presentation. Any other questions?
I have one. You said the screening for the Cologuard, or like just to say if we were putting on a health fair or whatever, we would encourage a Cologuard type of screening, or would we encourage, you know what I mean? What
Yeah.
would we do as far as if we were trying to?
The FIT test is the one that's pushed more. Cologuard is quite a bit more expensive. It does have a fairly high false positivity rate. That's sort of a quirky thing that I personally prefer. But FIT testing and colonoscopy are the 2 that are most recommended.
And at 45, or will we tell everybody to get a baseline, or?
I
I'm
think
just wondering.
as a general rule, you wanna use the number 45, but I think it really is it's hard for public health to be kind of in that field. That would be more of a, you know, get into your primary care doctor and get the proper
Right.
screening, because they're gonna need
Gotcha.
more of a history and
Gotcha.
background of when you should start.
And you should have, what, every 10 years?
For colonoscopy, that's again the general rule. That's assuming you had no
Is that
polyps or
an
no
old
other,
rule?
you know, if
Yeah,
you've got
right.
family
No,
history, they go
right.
5,
Yeah.
but as a general average risk every 10 years, yeah. The FIT test is every year, so you do a small stool sample every year. Cologuard, the other thing about it is it does take a larger sample of stool as opposed to the FIT test, which is just a small sample. So every year for the FIT test, every 10 years for colonoscopy.
We're at old business, Dr. Patrick, so.
Okay, great.
Jump right in. You want me to jump right in on FAB?
Yeah, jump in on that.
Okay, we are, March 1st, I think, we started putting this out, didn't we? So everybody is aware that we're doing our community health assessment, and our survey came out. That's the survey I sent all of you all in the email, the link. We have hard copies. We just were informed that we have them in all languages, French, Spanish. I think we have one in Hindi and another, Vietnamese maybe. So we have plenty of, we'll get that out to you all if you know of anyone. But if you know of anybody that need hard copies, we have them. Don't print them off, or you could. And make sure you send that link to everyone that you know that's in Butler County, that lives in Butler County or works in Butler County, both. So it doesn't matter. Really important. Often we take the survey and we don't get it down to our customers, our patients, our consumers, right? And so we wanna know, because this is all about resources that they need or that they may have or want. We changed questions in here. I was really excited because of our Ohio Is grant. We kind of went a little deeper and say, not only do you have a physician, but is it easy to get in? Do you have a dentist? Is it easy to get into the dentist? Because a lot of people say yes, but their dentist appointments are August, September. And so we wanted to know how access to health. We can have Kettering and Atrium and 2 FQHCs, which is Centerpoint and Primary Health Solutions, and a plethora of medical professionals in Middletown. How easy is it to be seen, to get in, to actually see them? And so we wanted to find out that as well. And so this is here. Let us know. Anybody in the office can make sure you get this. As well as I handed you out this. I made up a copy for our Ohio Is people that we were going, our community ambassadors, as well as the ticket to church. This scan or this link is for the Middletown neighborhood survey, and this one at the bottom is for our community health survey. So take one of these two. You can post this anywhere or place this anywhere, and these are for people in Middletown. This neighborhood, I'm getting a little ahead of myself, but the neighborhood survey is about parks and where you live, and do you think your neighborhoods are safe, and what would you do differently in your neighborhood if you could? What don't you like about your neighborhood? The city of Middletown, city council, and city organization is trying to look at neighborhoods, this survey. This one is a health survey, but health survey, we're talking about mental health, physical health, spiritual health, everything in this survey. This one's, both of them were pretty easy, I thought. I was taking them, if you do them electronically, you bubble them. So they're not too bad. You're just checking them here too. So they're not too bad. So if you need any of this information, we would love to get, what did she say? Like to get about 1,200 surveys for Butler County. I would love to get as many as we can for Middletown so we can make sure we're on the right track.
Are these getting circulated somehow, like, are they being hung up at grocery stores, on bulletin boards?
They're supposed to be circulated everywhere. So
Okay.
let me know if you don't see them, or if you do see them, or where we can place them. I'm concentrating on, what did I do? I did it to all of our city staff. I did it to council and health board. Then I started sending it out to churches. Then I put it into the community groups. Then I took it in parks. We have it at CBI, Head Start, schools. However, that we were gonna put some of these at Dollar General.
I was
That
thinking
only-
maybe pharmacies.
Pharmacies, see, that would be perfect. So we can
Gyms.
get that up there, gyms.
Yeah.
Perfect. Yep, see, gyms would be perfect. So, we could get one of these out, we're waiting for lamination paper to get them laminated, to put them out everywhere, to say if it QR code, and trying to get some kind of way we can really pull people in. I think even downstairs, the water billing, I think they have the city one, but they don't have the county one. The county people, which is our FCFC, which is Family Children First Council, you've been there, Ruth, those are all the agencies, so hopefully they're getting them all the way down too. But let me know if you are not seeing them, because we can make sure we plaster them up there and get the permission for them to do it. But, yeah, that would be great. This goes through April 30th, both surveys, through April 30th. And we check ours, we being the community health assessment, the the Butler County Health Departments, all of us, we constantly keep checking them to look at the income, age group, where we're getting them from, to make sure if we need to push them out further in those areas. Like if we're just getting them all from, young people, then we start pushing them out where we know that, like Central Connection and all those places. So we'll monitor them, but that's a good idea. I will put that down there and get those to all the front. Probably while you're waiting in line, if we can put them right at the first, like at the pharmacies and, yeah. But other than that, I think, Carla, anything else with FAB? I think we're pushing this pretty much now hard, trying to get this back until, so that's it.
Is that all the old business?
Well, one more, trap and neuter. There's a lot of information in here that Chandra found out about. I know that was the mayor's questions about trap, neuter, release, update. So it's plenty of information in here. She put also information about coyotes and what's going on with the wildlife stuff in here. So if you have any more questions, she was just following up on a lot of the information and
Well,
what season it is.
We want the coyotes to eat the cats they're feeding, right?
I would think, but I think they're on the runway, getting in the way of the
Not the
planes.
young cats.
Well, I mean, the wild ones that were getting fed out in the park going crazy, that's,
Yeah.
the
You know
ones, the
what?
ones they were concerned about there.
There's a big old bone out in this
Uh-oh,
parking lot.
uh-oh, are you serious?
And there's one end of it really chewed. Now,
Uh-oh.
that scared me walking in here.
Over on that side?
Yes,
Big bone?
big bone.
Human or wildlife?
I don't know.
Oh, that's kinda scary. We need to clean that up probably.
The only
Nothing
thing in
else.
addition to that, most veterinarians notch the ears.
Mhm. For the
You know,
kitties?
You trap, you neuter, but you need a notch so you don't have to try to catch him and see if he's been neutered or not.
Well, I have if you guys, if we had time, I wish I could blow it up on the screen. A person had a complaint about cats in her neighborhood, cause this lady's feeding them. And if you could see this video, it cracks you up. It looks like they're calling each other, hey, come on, and it's like 15 or 20 of them coming from underneath the car, and they're all walking down the street like a posse. And then they go up to this house, and they're like, it's a million of them, and I'm like, no. And it's so funny, cause Carla's laughing, her husband can't film it real well, and he said, oh, here, cause he's filming like the ones coming and the ones going down the street, and then after you see them all go down, then they follow right up on the porch to the lady's house, and I'm like, oh my goodness. So this is right off Main Street, and so I just, I don't know what I would do if I saw that many cats walking down the street at one time. I mean, I don't think you could just go, get, is a lot of them. So, more to come, but I think a lot of people are complaining that, I don't know, other than, like you said, neutering them, because if they're neighborhoods like that and people are feeding them. And then after that, we took pictures, we saw people are still feeding them in the parks, and so, and,
The thing with the park is people dump in the park too,
Right.
don't they?
right,
So you can trap and neuter
yeah,
as much as you want, but
people let them loose there,
yeah,
right,
it's
right.
controlling that.
Right, and we found an ordinance that said, that feeding of animals are illegal in the
Yeah.
park, but I don't know who's gonna manage
Yeah, I was gonna
that.
say, do we have the
Well, they
manpower
got you
to?
over
Who's gonna run off
that?
old people? Yeah, so anyway, so more information in there, but we did look that up. And we found no, diseases from coyotes. I mean, as far as people, remember she said it is a health issue. We didn't find any health issue other than maybe bones in the parking lot. I don't think it's any quote-unquote public health issues directly related to coyotes. But I think we're hearing that they're all around anyway, so I don't know. But I guess you put down here when you can hunt them. I guess you can hunt them, huh?
So, yeah.
Yeah.
I don't think in the city limits, but you definitely do out in Madison.
Oh, do they?
Oh, yeah.
They hunt them out there? See. All right, but that's it, Dr. Patrick, thank you.
Okay. Are you ready for new business?
Yes, we are.
Travel authorization?
Travel authorizations, we just have one, isn't that correct? It's Sarah Cheney that will be going. Sarah Cheney is our youngest sanitarian or environmental health specialist in training, and she'll be going to the OEHA Educational Conference, April 13th and 14th. the information's in the packet.
Do we need a motion for that?
And we'll just need a motion to approve that travel.
Okay.
Mhm.
Can we hear a motion to approve the travel authorization?
So moved.
Second?
Second, thank you.
All in favor of approving the travel authorizations?
Aye.
Opposed? Okay, you want me to move on to syringe exchange program?
Yes, but if I can ask you to put Public Health Week, I just wanted to mention Public Health number 3 first, because the
Okay.
syringe exchange program can go into our board topic discussions. We can just flow into that and talk until we're finished. But, Public Health Week is April 3rd through the 9th. For new board members, Public Health Week is national, and all health departments nationwide celebrates at this time. And they usually tell us what to celebrate, what to educate, whatever's going on, so it's usually the things that are going on around the country. And centering and celebrating cultures and health. So they talk about community and things that you can do for action, and then violence prevention, action, reproductive and sexual health, mental health, and rural health. So those are, accessibility. I'm trying to look through here. These are some of the things that kind of stay on the radar. Food and nutrition, and that is it. So for more information, when I talk on I'll just take a little bit from my bullet points. Ohio is, which is the Middletown Connect grant that we have with Safety Council. We've been meeting and talking about how we can accomplish everything in one fell swoop. So some of the ambassadors talked about health issues, walking, getting to the doctor, being better with their diabetes and their medicine, violence, et cetera, et cetera, et cetera. As well as talking to their, leaders in the community. So we kind of came up with a thing, and I think I mentioned this, but I've been in too many places. Walk and talk. So Middletown Connects Walk and Talk, and we will invite out city leaders from all walks of life. So that would be the healthcare industry, that would be schools, that would be city government, that would be any Centerpoint. I'm trying to think of all of them, CBI, YMCA, everybody in your community are invited out to walk and talk in these 3 census tracts. And we hope it would go on and on and on in all census tracts. But what they're gonna accomplish is 1, being outside and walking, but 2, meeting their leaders in the community, 3, seeing the leaders in the community, see the census tracts that we're trying to shine a light on so they can actually see it. And when you walk, you can kind of see what's in the community and what's not in the community. And then get to know the residents in that community so they can talk about their concerns. And so we're thinking that we might kick that off April 3rd through the 9th, being a part of getting out, walking, talking, connecting your communities, and bringing people down. So more to come, we'll get those walks out to you. I think there's gonna be 3 walks. We talked about 6, and we said, no, let's do 3 walks in the 3 census tracts. The 3 census tracts is Census Tract 130, 131, and 132. I'll bring the map in the streets at the next board meeting. But this is the one we had spoke about, where these 3 census tracts have the highest risk of disease, highest risk of education levels being below 12th grade, low transportation, et cetera, et cetera. They're supposed to live less than 12 years than other census tracts. And so why? So the thought process is, do I have to move to be healthy? And sometimes you look at certain neighborhoods in the country and you have to move to be healthy. And that's what most people do when they have resources. They just move away from those areas that are poor, resourced areas. When we went out, and I'm not sure how much of the board remembers when we started this, but when we did a lot of the data collection, there's very few assets in these areas, if anything. They have no stores, not even a dollar store, and that's usually in most areas. They had a couple of drive-throughs or stores that had cigarettes and alcohol on the front windows more so than, so we start looking at what's here, no laundromats. So it's really nothing in those census tracts. And when we get to the other census tracts right behind them, they've just lived it like maybe a year longer. And so we're hoping to start getting community involvement. And to be continued, but we're hoping to kind of mix some of these things together so that we won't be so spread out, because it's a public health issue with all those things that we were talking about for Public Health Week. So more to come with that. You'll get the actual dates. Feel free, hopefully you'll come out and share in the walks. I plan on, I don't know when the dates are, but I'm gonna try to walk in all 3 of them, just so that you can hear the voices of people and kind of look at the neighborhoods. But like I said before, you'd be surprised. I thought people would be afraid to walk in their neighborhood because of lighting or because of violence, and it was because of loose dogs. That was the number 1 reason. Yeah, so sometimes we jump to all the way over to our assumptions, and so.
Not loose cats.
Yeah, not loose cats unless you're on that one street. Yeah. So, or coyotes, right? So more to come with that. So that Public Health Week.
That is one reason I joined the Y,
Oh,
so
'cause
I
of
could
dogs?
walk, yeah.
I know. I'm not usually afraid of dogs, but if you ever had one come after you, and I can't jump on cars like I used
No,
to.
me neither.
I used to jump on cars, like I'd be up there in a heartbeat now. Okay, so now I could go back to syringe exchange, and this could be the topic, we can keep talking as we get in there, but, syringe exchange started in 2016, I think, we had an ordinance. So it became about by the board saying that, declaring an emergency for hepatitis C and HIV, for those that has been on the board. And so we've had a needle exchange for all these years, and in Butler County, there is one other needle exchange, and it's Fairfield, and it's on Mercy's campus, and, like way on the end of the campus at Mercy. Hamilton really needs one, but Hamilton really does not want one. Kind of refuses to have one and entertain one. So the conversation keeps coming up, do we want to continue having a needle exchange? Some voices are loud saying that they bring undesirables here and they stay here and they die here, and other people say we're enabling people. Others say that it just is not something they want in their city. And so when we start looking at it, the whole situation, the Board of Health is the authority over the syringe exchange, meaning if the support is from the board that it stays, it pretty much will stay. It's not like a council's decision or even the people's decision, in a sense, if we feel the need to have one here to help with bloodborne pathogens. And when the Senate bill passed the bloodborne pathogen bill, is because of that. They wanted to control infectious diseases. And a lot of the research shows that it does.
What kind of records do we have to how many people we serve
And is
how
that the
many-
new one in this packet? Yeah. We
how
do.
many are success stories, how many are the opposite?
Yeah, do we have a needle exchange report this
Yeah.
time? Is it in here? Okay, because I was gonna say, because we do have one in there. Success stories are hard, you know how that is, but we do have.
What about the rate of hepatitis, has that
Yeah.
gone up or down?
Yeah, we can get all of that. I think, I told, Jordan, he said he would get, this is the new Jordan, he'll get us all the stats. I said I would like him to get stats from 2016 to, and it's hard, and you can sometimes when they change definitions of new hepatitis C cases, then that changes all the numbers
Yeah.
and the data. And you guys know that when they change through, but we'll get all those numbers for you. But I want you guys to start thinking about that. Right now, the syringe exchange is on at Access Counseling's parking lot on Tuesdays. Access Counseling said it's the busiest day that they have on their campus in general, on top of the needle exchange. So if they were to let it stay there, they would move it to Friday where it's quiet. It's a quieter day on their campus. But they would like us to find another location. Now, you know, if we found another location, it would be looking around to see where you could put it. And that always have been the issue.
Is Access on Crawford Street?
No, Access is on Cincinnati Dayton Road.
Yeah, right
Right.
there at the end of
Yeah, where-
Old Road.
Yeah, right.
Like
Central.
across from
Cent-
bowling
yeah,
alley.
Central and
Central.
Cincinnati Dayton.
Right where T, dead ends, right in, like if you were at Cincinnati Dayton and Central, if you kept straight and go through the light, you would kinda go in their parking lot. It was on Crawford Street for a long time, it was picked on Crawford Street, cause that's where we found a lot of overdoses and dead bodies, and so we put it right where we found. And then it's moved since then, it was at the gathering, and then that caused a ruckus with, they said that, I love this, they said that it was attracting people downtown, and it's been gone, and people are still downtown.
Yeah.
But yeah, so they were saying it was attracting all the people to come after they left the needle exchange, they would just come right downtown, so when we moved it there, people still complain about downtown, so you know it's not the case there, but just think about it, and we'll talk, because if we vote to keep it, then Access Counseling would keep it there until we found another place to put it. But often, places to put it that people don't get concerned is in places that are like those census tracts that we talked about, that has no assets, but gets all the other challenges. So that's another whole struggle that you have too. So I just wanted to make sure that you guys, I'll do a packet of, the information from start to finish, what we're seeing, and, we'll go from
Crawford
there.
Street's very different now.
Mhm.
There's a lot of buildings removed.
Mhm, mhm.
I mean, it's still not good. but-
Right, they're tearing down a lot of buildings.
Yeah.
And you know, on Crawford Street, right where we were, you guys, the guy in the paper that we're having some of the problems with, is where they're having the, oh, help me out, it was an article in the paper with this pastor, Rice, I think, that's having,
With
foster kids or something that was, can you see that in the paper, I think? It might be in here, but anyway, it was a church right on Crawford Street, a big church. And then it's a building next door that we always have problems with.
Okay.
And then now they have some, I think it's a program that when foster kids get 18, how they can get transition there, but been having a few issues with or whatever, so it's that area that,
Oh,
it's just a,
bad.
yeah,
It's bad.
it's hard. What is really hard though, a lot of houses on Crawford Street are very nice too, so again, you have those mixed neighborhoods that are trying to do better, and then you put things in the neighborhood that helps depress them more, so, I don't know. But, to be continued, I want you to think about that, we'll bring a packet back, and maybe I'll check with, city manager if we wanna do official vote that we declare important to stay, or whether we, then, so, I always give you guys some thought,
Yeah.
give you some time to think about it, do some side research, we'll give some research on both sides of it.
That would be great.
Hard thing about, this is when you lose your location, it is very hard to find, I mean,
Reestablish,
oh
yeah.
yeah, it's just really hard to. And what's wonderful about having some kind of program is when we had to do Hep B shots and you looked for people that were very high risk, then we could always go to the jail and always go there to find people that we knew that we really needed the hepatitis B, and we really knocked out that outbreak really quick, because it spread with IV drug users, and it spread with, people that were using. So those are nice to have some program where you have a pulse, or you can get in touch with the people. Otherwise, it's hard to kind of scramble people together when you look at a high-risk population. So if some outbreak did happen, you know that certain people comes to certain programming, and so that's always good.
Weren't we parked behind Palmer Temps in that parking lot there, with the?
No, we
van?
thought about it, yeah, we thought about it. Narcan is kind of given out everywhere now, but we
Yeah.
thought about, that's, what was the name of that? Right behind Speedway, I started with PAX. I think it was called PAX. Was it PAX? Right
Yeah.
there behind Speedway, yeah, we
Yeah.
thought about it, that would have been a great location too.
I have a potential location for you. that I'll
Oh,
talk
see, okay, so,
afterwards.
yay.
There's
So-
no way to know where these people come from, though, to get the.
Well, yes and no.
Is there?
Okay, yes and no. When I say yes and no, if you, they know who the people are. When they sign up, they know that it's, Jackie Phillips, 2415, last social security. And they usually can look for duplication, even if people change their numbers a little bit. But addresses change, because it depends if they're couch surfing. A lot of times, people feel like they might get turned away if they're not from 45044. So they'll say 45044, they get kind of, you know what I mean, they get kind of hip to what to say. But if you see in our reports, we're getting them from Hamilton, Fairfield, Franklin, Warren County, Preble County. I mean, because when they give you all the reports, so we are getting them from all over. So we do see them come from other areas to come in. That's why it would be, the perfect thing would be everybody shared. You know, you have one in Cincinnati, but Fairfields, if you look at the report, when I give you the report, because I don't know if it goes back this far, Fairfields was from like 5 people visiting them to now 105. You know what I mean? It's gone up, the numbers have gone up, they've done things differently and attracted more people. So, and I tell people, when we get the surrounding areas and when we get so many, is the syringe exchanges in other communities are daily. Ours is once a week. If you go to Dayton and the Cincinnati, and Claremont County has a needle exchange or whatever, and Brown County has a needle exchange, they do it every day. So you might have
Clark County does
25
it
or,
like 3 times a week.
yeah, 3 times a week, say, and so that's why your numbers aren't as big as, because they're coming once a week here, so that's another thing too. They do use a lot, if you've ever wanted to go on and check, they do gather a lot of the resources there, from everything from combs to toothbrushes to pamphlets. People do say they go into treatment, people have it that they're ready for treatment, they talk
Yeah.
about them, and they'll go and somebody will take them right then if they wanna go, so they do have that. If it's a pregnant woman, which I've been on there a couple of times, cause we've given out vaccine, and if it's a pregnant woman, they take her aside and they take her immediately and talk about her and the baby and can she get in the treatment, and taking them down to Sojourner to do that, because that's really, you know, that's
Yeah, those are the kind of
the really
stats.
serious ones that you wanna, so, they really try to do it that way, but they feel like, in a sense, and I know we had the harm reduction, but when you start caring, it's not just about getting new tools, but when you start caring about your health enough, even though you're in bad risk behavior situation, and you start caring about your health enough and seeing people care about you, caring about your health, cause it's all free, then it could be something that pulls them over to the other side. So instead of just constantly ignoring them and feeling like, yeah, this is what you get, die if you, you know. So I'm a believer in harm reduction, but it is very hard to not convince, but sometimes you get kind of tired of, people get tired of it, and it's that, and I'm going through the same thing with people that are unhoused, the same thing, they're mentally ill, the same thing, I mean, it's just over and over and over, people get tired of seeing that, and think we have more than our fair share, so I get both sides of it, cause you know, when you look at it. But, I'll get a packet ready for you guys, if I get it before the next board meeting, I'll send it out, so you won't have as much stuff to read. And then we can maybe talk about it next time. I would like the mayor here for that discussion anyway too, so she can make sure she takes it back to the council. But that's all I have open to.
Jackie, my recollection, when it first kind of was proposed and voted on and started, was Hamilton then was reluctant, but the hope was that if Middletown did it,
Right.
and it went fairly successful and didn't have kind of all the problems that we're
Thanks,
worried
Jim.
about, that Hamilton would then follow suit also,
Right, right.
which obviously they haven't.
Mhm.
But would it be worthwhile talking to them and saying, hey, we're gonna quit?
Yeah.
You know, this is all gonna, cause when you do look at the numbers, even with the skewed data you're talking about, 25% of them are coming from Hamilton,
Mhm.
up here. So if they think that we're gonna drop it, and
Yeah.
nobody's gonna be doing it, unless they kind of pick up the slack and start doing some of their own,
Yeah.
would they be willing to reconsider?
We have talked about that on 2 fronts. One, the Butler County, the new Butler County Health Commissioner, Eric Bilster, you know, his building's right there on 3rd Street, the corner of 3rd Street, and he said they could come into his parking lot one day a week. That's Hamilton City, and he was thinking that maybe he could get the, you know, we'll watch it, we'll maintain it, and it's right there back. So he's been trying to work with the city manager there, as well as Oxford's supposed to be starting soon, if they haven't already. but Oxford was assured that they would just keep theirs. And if that bus that comes from Hamilton to Middletown, that goes to Oxford, start picking up all of Middletowns, it would be, yeah, so they are afraid of that happening too. Because if it stopped here, that bus would take everybody to Oxford, right? And so, they know, they're concerned about us not,
Doing
doing
it anymore.
it anymore.
Well, it's one
yeah.
thing to take care of your own, it's another thing to have all these people sending them in here. I mean, we got enough problems without, why should we take care of theirs?
You know, when they're consciously saying we don't wanna do
Yeah,
it.
that we're not gonna do it, I
Yeah.
mean,
Yeah. Yeah, and that's the hardest part, because you know that people cross borders all the time for different services. And it's the hard part to do that because our infectious disease have no problem crossing borders easy enough, right? So, yeah, that's that catch-22, but, yeah, so we're working all that. We'll have a meeting, this is kind of some of my report anyway. We have a meeting coming up on the 30th with Cindy Carpenter again and some of the county people, talking about our in-house situation. That's when that was brought up again, so we'll keep talking about it. But it is time for people to kind of share some of our challenges, right? And then that way all communities can be healthy and balanced, more so, yeah.
It'd be nice if we did, just like Clark County, they do it 3 times a week, but in close proximity, their locations are very close to each other. There's just such a need. If
Mhm.
Middletown did it 1 day a week, Hamilton did it 1 day a week, Oxford did it 1 day a week,
Mhm.
you know,
Right,
spread the,
yeah.
yeah,
spread the
Yeah.
challenge.
that's a term.
Yeah,
Um,
yeah,
you
in
know.
Fairfield, yeah, I mean, we could get it all, it's easier to do it that way too, and
Yeah.
they become very acclimated to the change and the time, and they can do that, right? And so, and that's a way of starting to, keep, I'm trying to find the right word, them on a schedule, if you will, and so that's the way that schedule, I mean, that keeps you mindful that, because they do come on a schedule.
Yeah.
I was gonna say training, but it's not training, it's that's getting in that mindset to come and do it, so, yep. But that's it for the needle exchange, I want you guys to think about it, I will get a packet to you ready. Stores. And any other board member topic, open discussion that we need to talk about, we need to bring as a agenda item? Any? Then move on to my report?
Yes.
I think I've kind of went through most of it, other than I was gonna kind of put Ms. Cash on, I handed out my report to you, the mental health circle. I was unable to attend that because I was at the Not in Middletown committee group. So can you give us an update on that? I know you had given me one, but I thought it was a good update.
Well, we haven't come to any conclusions about anything. But there is a lot of good sharing that goes on. We have, state representative on our committee. We have the police chief, and, the police are very, very helpful. They know the area like nobody else. And, we have a lot of ideas, but we don't have any plans yet, so. Really, I don't have that much.
But this was a mental health group. These action circles are the concerns of the citizens saying that something needs to be done, and it's considered, you get together and you have an action circle. And this action circle, we have one on homeless
Yeah.
and unhoused, and this was on mental health.
And we have, yeah, this one's on mental health. We do have a lot of, care coordinators that are in the area, and they are the ones that know the people and can give us all the updates and things like that. So if anybody would like to ever sit in, I think you'd learn a lot and you'd have a lot to give to that committee. Just give me a call and I'll take you to a meeting.
Again, something new and different that you guys can think about doing, but this is, again, the social ills that we have, that we have mental health, then we have addiction, right? And then we have
All of the above.
situational things, right? And so right now, they said everyone from 0 to 100 is suffering from some type of mental health thing, between addiction, depression, anxiety, more people with anxiety, etc. I was kind of anxious with the banks until I found out it was 250, I was 1,000, I was good, so I didn't have to worry about it's good being poor, it's a good thing being poor. But you know,
We have doctors on the committee that,
Yeah.
deal with the mental health issues too, and we have people from Kettering, other
Mhm.
hospitals and agencies,
Mhm.
so we are really reaching out in a lot of different ways. I did a police ride-along. I would have each one of you do that. It's very insightful as to what's going on in our community.
real easy to get on the
Easy,
right along.
all you do is call the police chief, and he puts you with, probably Holly, Jordan, and Victoria, I can't remember her last name, she is a care coordinator.
Hensley.
Mhm.
What is it?
Hensley.
They know these people in our city, they know them, by name, they know them. It's really good.
Yeah, and don't you think that sometimes if you get into a problem, it's not as big as you think it is? If we can just finally find that correct fit
The
with
pickup
individuals.
stick that wiggles
Yeah,
the pile.
right. So that's really interesting. Thanks, Sally. Oh, other thing I'm kind of excited about, but it's gonna take a little bit of work. Carla, you're gonna talk about Tobacco 21 probably, aren't you? So with that Tobacco 21, that's another grant, and you guys let me know if you don't know what I'm talking about, but Tobacco 21 is, we're gonna start licensing facilities that sell tobacco. Vape stores, like Kroger's, corner stores, markets or whatever. And so we have to go through the process of educating the vending people, and then we start licensing them, and then we start doing those prize checks, compliance checks. And so I'm skipping down, Carla can talk about where we are with that process, we can get it back to them, but our new workforce development grant, I am hoping that we can start maybe hiring grant writers, health educator, summer interns. The summer interns could help us with the compliance things. You have to be 18, but, and below 21, right? I think that's it. And so, more to come. Workforce development, supposed to be developing the public health workforce, so getting younger, staff people in and help us do some public health activities would, be good for all of us. And so, when I said kind of scared, it's gonna take work to kind of structure a program with interns. Somebody always has to manage them, but we're excited to be doing that. And I think I'm looking over the rest of my notes, all the rest of them, I think I've already talked about, so that's it.
Thank you, Jackie. Carla, are you ready to,
I think it's medical director next.
are we medical? Oh, okay,
Right there, yeah.
there we go. Thank you.
Reportable illnesses this month, we had 18 chlamydia, we only had 3 gonorrhea, 8 hepatitis C, going back to harm reduction, 2 hepatitis B, 0 hepatitis A, 1 HIV, and 1 strep pneumonia. That's all I have.
Is that pretty good? That sounded pretty good.
Well, there's always just up and down fluctuations, it's on par with normal. Yeah, it is less than last month,
Okay.
but it's not there's no trend there. Unfortunately, there's no trend.
No big.
No. We're back up to our normal numbers. COVID kind of slowed things down for a little bit, but not significant.
Speaking of COVID, is that, you know, it seems like there's a typical rise in January, February.
There typically is, but there really was not a big one this year. I didn't really go over that because usually it's Chandra,
Yeah,
but.
yeah, it's her.
But
she and
we
you.
were pretty flat through December and January. It was not a typical spike.
Yeah.
I think for a lot of different reasons, but, and flu came kind of early in December, but died off very quickly, and
report said the same thing, that cases continue to decline. She left a report for me. She is at a infectious disease meeting in Cincinnati. And we continue to offer the bivalent vaccine. I was looking at my card and I was boosted in October. And so if the vaccine wanes about 6 months, that would be typical if people are starting to get, because I bet everybody kind of got their booster last fall in October. So, you know what I mean, that might be because we're
Majority, yeah.
starting to see some cases around, so that would be normal.
Do they recommend that every year then now?
Well, that's kind of becoming the question is, you know, that.
I mean, I had 5 shots.
I know, I think I've had 10.
And how long it lasts has evolved, you know, they originally said 90 days, and now
I'm
they
thinking
kind of
about-
are saying 6 months,
I'm
but at the
thinking
same
6
time, they're
months.
saying get it once a year. So does that mean it lasts 12 months, or is it just, because there's usually a spike in the summer.
Right.
Even last summer, we had a jump in June, but, so, yeah, there's no good answer there, I don't think, right now. But I think the trend is that it's gonna be a yearly thing in the fall, with or without influenza.
And so I talked about Chandra's report, cat and coyote concern. She had that in the packet, and she discussed feeding, and there's an ordinance that says no feeding, trap and neuter release. Residents can make their own arrangements to personally trap cats, transport them to the UCAN or the OAR for altering at a reduced fee, and then return them home at a reduced fee. I don't know how much that's gonna happen. Risk myself getting the cat and then pay for it to bite me.
Yeah.
Pay for it to bite me? I don't know. And then, she has that, ODNR, that's in the packet too, guideline for hunting coyote, licensing fees and contact information. So all of that's in the package that she put in there. And then you can contact licensed animal control to discuss options as well. Very expensive again, so good luck. I mean, have you ever tried to get people to get stuff out of your house? It's very expensive. It's like $100 a fur.
You mean like a coyote in your house?
No, raccoons and stuff.
Ooh.
Yeah, so I just said, oh, well, it's gonna die in there. I just trapped them up in the freezer. So that's it. That was Chandra's report. Now,
All right,
it's
thank you.
Carla.
Now, Carla.
As Jackie mentioned, we are continually meeting with Envision and Interact for Health, with Health, for Health. With the Tobacco 21, they are continually assisting us to implement Tobacco 21. We're hoping that Interact for Health assists us with some funding, so once we figure out what we need, I believe they'll give us a few dollars. We're probably in the summer, we'll start with the education and then plan to send out the applications, November or December for the facilities, and then implement, by January 1st as far as the whole program. So, do you have anything to add to that?
Did you guys
Well,
remember any of this, the new people on here, about the Tobacco 21 licensing stuff? Okay, cool. Yeah, so just let us know if there's anything else. This money is supposed to help with staffing that you get from the licensing, but it's really important that we spend the majority of the money on education, so we can just make sure. And it helps us with control over the vaping, because most vaping stores have no regulation, 0. And so it helps us to see what's in there.
So again, right now, we have about 70 facilities that will come under our license. If we find any more, we'll hopefully not, but right now we have about 70 facilities that we'll license.
Yeah, and Hamilton
And this
has.
just targets the age though,
Yeah,
selling to under 21.
under 21. Yeah, and
We-
it targets, selling marijuana and some
Well,
of them.
that was
what
gonna be my
Hamilton-
question, because, yeah,
Yeah.
surprising to me, we had a student that the vape they bought in Middletown contains THC. And
Absolutely.
apparently that's very common because
Very.
they're shipping them all over the country from states where it's legal. And, you know, the
Mhm.
manufacturers are just shipping it anywhere.
Yeah.
And so they had bought a product here that definitely has THC and, you know, just bought it over the counter.
Yeah.
Hamilton, store had rated a vaping store that had, marijuana too and THC. So hopefully we'll find those two, because at least we'll know where the vaping stores are, and we'll be going into them.
And they're,
get a
you know,
license.
you get online and look this product up that this kid had, and
Right there?
they advertise it as THC, and they're
So
not.
they know it's in there.
Yeah, oh yeah, and they're not hiding it, they're not, yeah.
Yeah,
I mean, and the store owners presumably ordering because they know it's there and can get it delivered,
right,
and
right,
apparently very easily accessible.
yeah.
Yeah, I think too, when I talked, there's one school in Hamilton that's testing the kids, I think, is it,
Parochial school, probably?
it's a high school, and no, it's a public school.
Public.
And they said that they're finding that the kids are buying urine from these places also.
Are they
Ah.
testing all the kids?
Yeah, they doing random testing.
Yeah, that
So they
urine
carry the
test,
urine around with them in case?
that
Huh?
urine test.
Yeah.
Carry the urine
How they
around with them in
gonna know?
case?
That urine test has gone out the window, I've heard that a long time ago, they
I-
always tell the kids, get up and save the urine for me.
I said they should do the hair. My son, when he was in school, they used to, that was
Do
a
the hair?
parochial school, but they used to test the hair, but don't have to worry about the urine, but yeah.
Yeah,
Um,
and Hamilton
so
has started their
They have
program.
started their
'cause They were
licensing.
winning their licensing.
I think they have
Hamilton
about,
City.
they have about 50% of them
Mhm.
licensed, so we'll assume to that. We have about 12, facilities that, we're still waiting on their license renewals, so we're still working on the renewal of the licenses of the FSOs and RIDs. We have one facility, Billy T's, that's a bar that we've doubled the fine for smoking. They're allowing patrons to smoke, and anytime we know that they're doing it intentionally, allowing people to smoke, we can double the fine, so their fine now is $5,000.
Where is
Boy.
that? Where's Billy
that's
D's?
Is that on Route 73?
Titus, yeah, yeah,
Titus.
yeah. So, we'll see. how
Has
they
anyone ever
fare.
paid any of those big ones?
I don't know if they have paid any of their fines yet.
I mean, but it's, in the
Oh.
past, you had them,
Past.
some pretty
Yeah.
big ones in the past. Did they
Yeah.
eventually all
Yeah.
pay up those huge fines?
I'm not sure,
You know?
I'm not,
They
cause
closed.
the one place closed. and
That's
then
how they
the-
close, that's how you get out,
Yeah.
they close.
Yeah.
So,
Hillbilly Heaven, is that the one?
Hillbilly is closed, yeah, that one
That
closed
was-
too.
They didn't
That- the
smoke,
other
they
one-
just had TB.
That one was Jimmy's Lakeside, remember that one?
Yeah.
That was on
Looks like
Titus,
it's
he
on
closed
that.
as well.
Was it Lakeside?
Lakeside Inn, yeah.
No bar?
Under the
Yeah.
train.
So other than that,
It's there on
that's it for me.
What do you have as far as the homes that are not tapping into
We
the
s-
septic system on Leperson?
We still have 3 that need to tap in, and I can't get, I emailed and spoke, well, I haven't spoke with them, but I emailed the law, it's in the law department, the prosecutor's office, and they haven't responded back. So I'll follow up again on that. We follow up every couple of months on them, so we're waiting on them to serve them their summons, so we have 3.
Well, what do they do? I mean, how long you give these people?
They've had
Is
quite a
this
while.
lifetime
Yeah.
or, nobody pays the fines, nobody does the thing, what the hell are they doing? I mean,
Welcome to the health department.
I
You have no-
know.
you have no teeth.
gee, I mean, come on.
Yeah.
No, nothing, huh?
Nope, I'll follow up again. I guess I followed up, I think, about a couple months ago, so we're waiting on the prosecutor's office.
They always say, unfortunately, that if you get 95% compliance, you're doing good.
Sounds high.
And right now, that's probably where we are, right?
Yeah.
Cause everybody.
Well, then you're doing pretty well.
Yeah, doing pretty good.
It doesn't make the ones who connected like they were
Feel good at
supposed to
all.
feel good at all, and that's the
Well, right.
complaint that we get
Yeah.
a lot of times with that.
That's the hard
so,
part,
Yeah,
that we become the bad guy, because if I would've known, I wouldn't have done it either.
yeah.
That bar at the end of Central, do they still have a warning, like when you walk in? I remember one time you said they have a habit that they do when I walk in to check them. Do they still do that?
I am not sure.
Okay.
Forget about the
Which
smoke
one?
in the air, huh?
The smoke, yeah. I think we get a lot of compliance, for the bars now. You get, have a few that it just doesn't allow smoking, but I think we pretty much get a good compliance. So,
That's good. She's got got a job, I'd never do it. It's hard.
Anything else, Carlos?
I'm
Okay, thank you. Jackie?
No?
I guess we'll adjourn to the next meeting, which is April the 11th.